Good evening and welcome to another episode of Stroke Rounds. Today we are discussing an interesting case of a middle-aged lady, 50 years old, who had sudden onset severe headache, excruciating headache while swimming. She says that this is the worst headache she has ever experienced in her lifetime, as if something has burst in her head. A CT scan was performed immediately, which reported as it revealed a right paracentral subarachnoid hemorrhage. So she was referred for MRI evaluation. An MRI showed this is the MRI report: acute/subacute subarachnoid hemorrhage in the right frontoparietal and occipital sulci, suggestive of subarachnoid hemorrhage. Then a thin subdural hemorrhage in the right medial frontal convexity. The patient was referred for a digital subtraction angiography. The patient underwent angiography under the radial route by the radial puncture. This is the left carotid angiogram, AP view, lateral view. This is the vertebral angiogram. What I am showing here with my finger are the areas of focal narrowing and a beaded appearance, which can be seen very clearly. This is the right carotid angiogram, lateral view, showing the anterior cerebral artery, the calloso-marginal and the pericallosal branches. Here also the beaded appearance can be beautifully seen, areas of vasoconstriction and small vasodilatation. So this is a typical case of what is called a reversible cerebral vasoconstriction syndrome, or RCVS. This condition presents exactly like an aneurysmal subarachnoid hemorrhage with sudden onset severe thunderclap headache, and was always usually associated with a sulcal subarachnoid hemorrhage. It is characterized by reversible multifocal areas of vasoconstriction of the cerebral arteries. There are many things that can trigger a RCVS. One is illicit use of drugs, selective serotonin reuptake inhibitors like SSRIs, postpartum state, patients with migraine, even in people after excessive physical exertion or emotional stress. The vasospastic or the beaded appearance of RCVS is diffuse, involving many arteries, involving the medium and small vessels, involving both the anterior as well as posterior circulation. Usually, the outcome is extremely good. The management and prognosis is good. Management involves use of calcium channel blockers like nimodipine for cerebral vasodilatation, blood pressure management to keep it at the optimal level, avoidance of triggers if there is any. Most patients with RCVS recover completely within 3 months, but it can rarely lead to complications like ischemic stroke, massive hemorrhages, or a posterior reversible encephalopathy syndrome called PRES. And the diagnostic clue is, if you repeat the angiogram after 3 months, all these areas would have come back to normal. So the take-home message is, when a patient presents with a sudden onset severe headache suggestive of subarachnoid hemorrhage, and the CT scan shows a sulcal subarachnoid hemorrhage, and an angiogram shows this appearance, it is conclusive of the entity reversible cerebral vasoconstriction syndrome. Thank you, and see you again in the next episode of Stroke Rounds.